name is Louis Morales Hermosa, student level 2 student nurse from Southwestern University of Finland. For today, I will be demonstrating nasogastric tube intubation and administering enteral nutrition via nasogastric tube. So first, we're going to do the nasogastric tube intubation. So we're going to first to assess the patient's need for enteral feeding, and we're going to assess for the presence of any skin breakdown, and then the findings from the nostrils by instructing our patient to breathe while including one of the nostrils at a time. Then after that is we're going to review the patient's medical history, such as the diagnosis of the patient, nostril surgery, unusual nostril bleeding, the mental status, and then the bowel cells. And then after that is we're going to explain the procedure to our patient. Then we're going to inform them how to communicate during intubation, just like doing hand signs or raising their index finger if there are any discomfort. And then after that is we are going to prepare our equipment. So if we prepare them, then we're going to position our patient in a semi-high forward position. And then we're going to position the patient semi-forward if it is comatose, and then with the head from forward with the use of the pillow. And then after that is we are going to put a towel. Put the towel, then we're going to perform the hand washing, hand hygiene, and then wear our gloves. Then wear our gloves.
So now we're done wearing our gloves. We can now, after wearing our gloves, we're going to check for the tube placement. So we're going to inject again 10 cc of air.
Lens tube.
Now I can hear a gurgling sound, so it means that our tube is
And then after that is we're going to determine the length. So we're going to insert and then we're
a
going to
gastric
mark
content
it.
or the residual volume of the patient, and then measure the residual volume if present. And now we can now irrigate the tube. So assume that this is a 30 to 60 ml of water.
Then after this we're going to put a preferable lubricant of the first 4 inches of
After we can now start the tube feeding.
tube.
Assume that this is in milk.
Then we're going to ask our patient to flex their nut backward. Then we're going to gently insert it to the patient's nares.
And then once the feeding is done, irrigate again the tube with water. And now we can clasp and clamp the tube, the distal end of the tube.
Then, as the tube reaches the nasopharynx, we're going to ask the patient to flex her head forward. Then we're going to advance it per inches,
We're
and
going
then
to
gently
maintain the
as
position of the patient into high
at a time
position
as the
for
patient
30
swallow, and then
minutes
if
to
the
1
patient's
hour. And then now we
having
can
the respiratory
document.
distress, we're going to withdraw it immediately.
That will be all.
So ma'am, so hello. Then we were going to keep on advancing it until we reach the mark. And as we reach the 8th mark, we're going to secure it, the patient's nose. is we're going to check replacement by inserting a 10 cc of air, then run endoscopy. Then as we already working, and after that is we're going to aspirate for its gastric, and then for the uh, then measure the pH. Then if the chest X-ray is prescribed, we're going to prepare our patient. And then after that is we are going to we're going to clamp the distal end of the tube, and then we're going to clamp the distal end, and then we're going to clamp the caps or clamps the distal end of the tube, or we're going to connect it to the suction machine or the tubing bag. And after that is we're going to fasten it to the patient's clothes.
Review the patient's medical history. Next is to
After is we are going to
prepare all of the materials that and then
and we're going to remove our gloves and then the materials that have been used, and then perform hand washing. And then after this, we're going to position our patient in a comfortable position, and then document the procedure. Now we're going to proceed on the feeding. So the first thing that we're going to do is we're going to assess the patient's need for enteral feeding, and then the food allergies of the patient. And after is we're going to auscultate for the bowel sound. And then after that is we're going to obtain the weight baseline of our patient, and then the assess for review the laboratory values of our patient, and then the assess for any electrolytes abnormalities, and then the residual volume for excesses or deficits, and then for like the metabolic abnormalities such as hyperglycemia. And then after that is we're going to review the healthcare provider's order, and then next is we're going to explain the procedure to our patient. Then we're going to prepare for feeding, and then the materials needed. Then we're going to position our patient in a high pulse position, sitting position. Then we're going to wash our hands again, and then put some gloves. Then we're going to check the tube placement by using the step, putting again.
after doing so is to ask the patient to flex their neck backward, and then gently rotates the tube, the first 4 inches of the tube, and then gently insert it to the nostril of the patient.
And then after we're going to
Ask the patient to flex their head forward until it reaches to the nasopharynx,
we're going to
and advance the tube multiple times. And if it has any signs of respiratory distress, is to remove immediately. And next is to advance the tube until the tape marks.
going to check for the gastric volume, and if there is present, we're going to measure it. Then after it, we're going to irrigate the tube with water.
Next is to secure the tube. Putting a tape.
And after irrigating, we're going to start feeding. Gently feed it. Caution that we're done feeding, we're going to irrigate it again.
Secure the mouth of the tube.
And after that is we're going to caps again or clamps the distal end of the tube. Then we're going to let the patient maintain on the high power position for 30 to 1 hour minutes, and then we're going to document task procedure. That will be all. Thank you.